Navigating Your Health Today is pleased to introduce Dr. Deepak Shrivastava. Dr. Shrivastava comes to us with a wealth of knowledge. Board certified in pulmonology, respirology, internal medicine, gerontology, and sleep, Dr. Shrivastava shares with us today practical advice on how to navigate your health today through the coronavirus pandemic.
Now, what we don't know is that how long that protection will last. So once you recover, as I said towards the end of my last webinar, that it could last forever, lifetime, or any time short of that. So we need longitudinal observational studies that will tell us that this antibody will be helpful in the long run. If not, yes, definitely once we have the vaccine, just like we do for the some other vaccination and do the booster shots, we'll definitely need those booster shots to remind our immune system that they need to continue to have enough concentration of qualitative and quantitative antibodies which will protect us.
What would you say to those people who think that the silent hypoxia that occurs, where people, their oxygen saturation could be low and they're oblivious to it, and they get to the hospital and it's profoundly low, and they're saying that it's because it's not a pneumonia in the traditional sense, but it's more these blood clots that are occurring in the lungs, and they're saying to chew on 4 baby aspirin and head to the hospital. Like, have you heard about that, or what are your thoughts?
I have not heard about the baby aspirin and head to the hospital, at least. But the point that you are bringing up is what is called silent hypoxemia is extremely important, and its identification, because once your oxygen saturation drops below 90%, the cells are struggling for the metabolism, and they need their substrate metabolized in order to get the energy. That's the very basic science of oxygenation. Therefore, although the person may not have symptoms or may have some degree of shortness of breath, but they definitely need to go to the nearest healthcare facility and get their oxygen saturation checked. We responded previously and I just wrote an editorial on that we responded very vigorously with the intubation, early intubation and mechanical ventilation in order to raise their oxygen saturation. Well, it seems like that current observation shows that there is higher mortality rate with that approach. So saying that we don't have to take a very aggressive approach in that setting, we need to improve the oxygenation by less invasive means, because without improving the oxygenation, your organ systems are at continued risk for vulnerability. When the cytokine storm hits, suddenly the body is not ready to protect itself in the setting of the hypoxemia. I'm trying to just translate it into simple English for understanding, although there is significant science that we know of. So it's really important to understand that that's a turning point. If you remember, the difference between the mild and moderate disease classification currently is based on shortness of breath and hypoxemia. So if you have shortness of breath as an indicator maybe of hypoxemia, or you do not have shortness of breath, but you are feeling tired and just it's very difficult, it's very non-specific. And most of us don't have pulse oximeter at home to check our oxygen saturation, but therefore the indicator is probably just your symptom. It's better to check, or you are just not feeling well. So what you heard that you have cough, you have fever, you have nausea, abdominal pain, vomiting, but you are unable to explain something and you still feel sick. It's better to seek help at this time rather than wait for too long.
Is there always a fever? And if there is, should you treat it or should you let it run its course to try to fight the virus?
Okay, so not necessarily that you have to have all of the above symptom or one of the above symptoms. You could be infected and you may not have any infection. The recent data as of yesterday from CDC now saying that almost 25% people may be asymptomatic carrier, a number which used to be 3 to 5% has not now gone up to 25% people in the community could have the infection, and you could be one of them. Now, having said that, people with mild disease, and if they do have fever, yes, the recommendation is that they take medication just to take care of the fever. Things like antibiotics, etc., in the absence of a secondary bacterial infection are not helpful. At that time, you have to seek help and go to your physician if they are available, or nearest healthcare facility.
You talked about ACE receptors. So if I'm on ACE inhibitors for my blood pressure, should I stop taking those? Is that going to make it worse for me?
And no. Although there has been a lot of press about the ACE receptor in the beginning of the COVID-19 pandemic, and people were really panicking about the upregulation of the ACE receptors in people who are taking the medications for the control of their blood pressure or protection of their kidneys. There are multiple indications. These are very, very good medications, but just like any other medication, they have side effects. And at this time, the current recommendations from every source is that you continue taking your medication.
So you talk about obesity being a big risk factor. Is this the time for me to start trying to lose weight?
This will be a good time, and unfortunately, the environment is not conducive to weight loss as opposed to with the staying home and lockdown orders, etc. The people are eating more, they are exercising less, they have less opportunity to exercise, less space to exercise. So it's a very difficult situation. They are drinking more alcohol. Everything that we are doing at this point will actually increase body weight. So it's a very, very good idea at this time to lose weight and try to lose weight as much as you can.
I've read about people who've had COVID, they've recovered, and then they test positive again and again and again. Or they were recovered, they're cleared, they're sent home, have this profound exhaustion and can't seem to get back on their feet. What are your thoughts about that?
Yeah, that's part of the recovery that we are learning more and more. And the current thinking is that it's possible that the test, that the diagnostic test that continues to come positive is from the viral shedding of the DNA that is destroyed, and this virus probably does not have the same level of virulence or contagiousness that it used to be. However, while you are still positive, you need to know that what your symptoms are, and you should follow the guidelines of staying home or social distancing, so that inadvertently you don't go ahead and infect others, especially your family members or friends, because they are likely to be close to you.
So you spoke before about masks and the issues with masks. Are the masks to protect you that we wear in public, like the cloth mask that people are wearing?
Yes, the purpose of these masks that the current recommendation is in the general community is in fact to protect the others. The mask that you use, homemade mask, let's say, the intention is not to protect yourself. The intention is in case you are an asymptomatic carrier or you have a mild disease that you are not aware of, you do not spread it to the others. And again, remember, it could be your family, it could be your friends, and the people who are near you. So you definitely want to wear that mask.
Do you have any other comments you'd like to make to people about what you are learning? What have we learned in the last 50 days that gives people more hope that we're kind of getting on top of this and things hopefully can go back to normal at some point?
Well, just like anybody else, I don't like to just sit home and not go to work. But this is an opportunity for most of us. If we put a little twist of positive thinking on current situation, let's face it, you cannot help it, you like it or not. So why not take advantage of the situation and do some positive work around the house? Do something, finish your projects which have been sitting there for a long time. And it's easier said than done, but because we like to go to work, we like to earn our livelihood, but you cannot do that. So that's one thing that I'd like to say. The second thing that I really like to say is that vaccine is nowhere in near sight in terms of 2 or 3 months. If you listen to CDC and other sources, everybody is saying that it will be 18 months or 24 months. And as we are getting more and more desperate, and there is this push to open and reopen the facilities, services, one has to be extremely careful and not let your guards down, because I'll tell you, no matter what who says, the infection is there, number one, and number two, there is no protection and you don't have 100% proof treatment. So once you get sick, and if you are at high risk, I don't think that the disease is going to be forgiving and takes any different course that it has taken in the last few months. So one has to be extremely careful and follow all the things that we have learned by lockdowns, social distancing, hand washing, and wearing the face mask, which has really helpful, has not completely flat out the curve, let alone lowering the curve. So don't let your guards down is my message.
Thanks. I think that we'll leave it with that. That's really good.
Thank you.
That's good. Yeah.
Thank you so much.
Navigating Your Health Today is produced by Julia Worrell, the Sleep RN, and Director of Correct Sleep Solutions.